I love this question. So when you're doing a breast reconstruction for a breast cancer patient or a BRCA patient and you have chosen an implant-based reconstruction, there is really two ways to do it. So direct to implant is what I do. So at the time of the mastectomy, I put in the long-term implant at the same surgery. So you go into the operating room, you have the breast removed, and I reconstruct it with an implant. Now, the other type of implant-based reconstruction is called a tissue expander-based or two-stage. So instead of going direct to your implant, you are starting with something different, which is called a tissue expander. Now, this is a saline or saltwater implant that has a gummy port on it. And this can be put in and left deflated or only partially inflated. And then they allow you to heal, or we allow you to heal for a couple weeks. You come into the operating room and we can slowly inflate the implant to the desired size. And then you go back to the operating room for a second procedure where you have the actual implant placed. So that is a two-stage procedure versus direct to implant, which is a one-stage procedure. My preference is always direct to implant. That's what I do in my practice. I think that should be the goal, if at all possible, but sometimes it's not. So as a patient, it's really important to discuss with your surgeon whether you are a candidate for one stage versus two stage. And if you're not a candidate, ask them why.